All right, is it recording? Yes. Okay. Okay, welcome all. My name is Elizabeth Johnson Phillips. I am the content developer for MPWRSource, and today we are discussing teleworking, reimagining telework, and what that is like in light of the coronavirus. Some of us have been teleworking for a while. Some of us are newbies to it. There are different perspectives, whether you're an employee teleworking or you are an employer managing people who are teleworking. There are different challenges for both, and we want to discuss that. To tell you who we have here on the panel, we were supposed to have Dennis Cow of Proactive Information Management, but we have upgraded. Instead, we have Angela Davis of Proactive Information Management. She is a client concierge and she is much better looking, and she will be able to tell us all that you need, speak to how the things you might need to set up your office for teleworking, some technological issues you may run into and how those can be met. And she has also teleworked for a long time, so she's a pro in that arena as well. We also, do you want to say hi and say why you're here?
Hi. Yeah, I'm here to help you guys understand how teleworking can be beneficial to you and all of your clients, and just be able to shed some light on what I do and how it's worked for me.
Awesome. Next, we have Tommy Diener, who is a human resources goddess. She is not Toby, but much better. And teleworking presents a lot of human resource challenges in terms of what to do in a meeting, how to set parameters for what may be okay during a coworker meeting may not be okay in a client meeting, and how to handle people working from home in their pajamas and those sorts of things. You want to tell us a little bit more about yourself, Tommy?
Yes, so I actually am new to the teleworking game myself. I just started at the beginning of March when COVID started, and it's been an interesting experience. We actually have had a lot of folks working remotely, so learning to navigate the waters as a leader and also as an HR professional. So I'm excited about this discussion today.
Next, we have, as though one Angela was not enough, we have a second Angela, Angela Simmons of Centravance Consulting, who is our expert on all things compliance, on HIPAA, OSHA, and other scary things. Not scary. Scary is not the word I'm supposed to use. I'm supposed to use.
Scary's right.
On all government regulations, but to talk about how many of you teleworking presents some different challenges. Whereas I might have the challenge of my kid running in the back, and that would be embarrassing. It doesn't present a safety issue for what I'm working on. There are no state secrets here. But Angela, can you speak to some about how your expertise is unique to teleworking?
Yeah, so I think with one of the things, I think first of all, we have realized in the United States how much can be done via telework. We are seeing some major changes with what can be done via telehealth. The regulations have been loosened a little bit right now, and I think that there may be some permanent changes that will occur with that, so that we can do more at home. We're never going to get rid of the healthcare worker. That's not going to happen. We're going to need face-to-face. We are going to need facilities, but I think that we're going to be able to do a lot more from a home setting or other settings. We're going to be able to do a lot more exams and a lot more triaging and finding out what's going on with a patient prior to them actually coming into a facility. So with that comes some inherent risks of making sure we've got the right platforms, making sure we've got the right security on devices, making sure that employees understand their responsibilities as well when they are sitting at home or whatever their distance location is going to be. So we'll speak to those things today.
Awesome, thank you. And lastly, we have Tiffany Joy Green of MPWRSource, my boss. So if I do this wrong, don't anyone let her know.
Doing great.
Communications and how to communicate with your team is a big thing during teleworking. So can you speak to some about what you're going to bring to the table for us today?
Well, first of all, MPWRSource, most of our employees have been telecommuting since the launch of MPWRSource, so almost a year now. I myself have been telecommuting, I call it telecommuting, but teleworks for 10 years. I've worked for and managed marketing staff from New York to California to Virginia. So for me, it's kind of just commonplace for the last 10 years. I think the key, as it is even face-to-face, is open and honest communication and making sure that you are constantly communicating and using all the appropriate means of channels to actually communicate with your staff.
I can attest to the fact that she does constantly communicate.
I've never been told I under-communicate, never in my life.
Nor have I. It's shocking that we work in communications. So in terms of, to really get right into it, I have a list of questions here, and some of these are going to be more healthcare related. Some of these are across the board. But in terms of human resources, what can we make our employees expect to, what are reasonable expectations for, we'll just say codes of conduct and like clothing? I mean, it's different. We've all seen the memes about, you know, pants optional and all those sorts of things. And, you know, what are reasonable expectations, Tommy, that you can set for employees?
Yeah, I think the important thing to emphasize when you have employees working from home is that it is still work. And the expectations that we have related to professionalism are going to apply whether you're working from home or whether you come into the office. I think the situations in terms of the flexibility while working at home related to clothing and maybe scheduling might be a little more loose or free-flowing. But again, I think employees still need to use their good judgment related to that. So if I'm going to be on a call, I need to be appropriately dressed for that call. If I'm going to be working and just doing computer work all day and I'm not going to be client facing or employee or colleague facing, I may be okay in sitting in my pajamas. And I think that's some of the benefits of people being able to telework. But we still have to reemphasize that it is a work environment still. And you need to be professional. And we're adults and we should understand where those lines are. And you set those expectations with your employees, both in the office and at home, the same way.
So pants not optional. That's what I hear you saying.
Pants highly preferred.
Highly preferred. I personally am a fan of the business mullet, where it's business up top and pajamas on the bottom.
Yeah.
That's what I'm a big fan of. But even Tiffany and I were discussing, if you are having a sort of a peer like team meeting, even if you say to your team, okay, it's casual, we're going to be in our jammies, we still need to be mindful that everyone wears different jammies.
Some people don't wear jammies at all.
So make sure that you know your bathing suit parts are covered.
Yeah.
That's what I tell my children. They're like, you know, the difference between like a spaghetti strap is not going to be appropriate, whereas a t-shirt might be fine for if you're just having a team meeting and you're not in front of clients.
Agreed.
Yeah, I kind of said to Elizabeth too, if you're not comfortable or your kids are not comfortable seeing you like that, it's probably not appropriate for work either.
Absolutely. Absolutely. And again, you know, you still have those challenges in the workplace too. You know, I can't tell you how many conversations I have about leggings, open-toed sandals and flip-flops. You know, the issues don't go away when you're teleworking or when you're in the office. Again, you have to kind of approach them in the same manner in terms of using common sense and judgment about what's appropriate.
Yep. Now, if everyone's wearing their appropriate pajamas, as an employer, as a team leader, what are some ways that you can make sure your employees are being productive? What's the best parameter? Do we need to punch in a time clock? Do we need to send you timesheets? What is the best way for you to keep tabs on what's happening?
So I've been reading a lot of articles about employer spyware. I don't know if you guys have read these articles where a lot of employers are installing two-way cameras and capturing images of their employees while they're teleworking because they have concerns related to productivity and are people really working as they should be working. I personally hate that concept. I truly believe, and you have to be careful depending on what state you're in, whether or not that's legal or not legal as well. And Elizabeth, I'm sorry, Angela might be able to get into that a little bit as well from a technology perspective. But I personally hate that. I think that it's no different, again, from being in the office. You have to trust your employees, right? And are they meeting the expectations that you laid out for them? So again, it gets back to clear communication. This is what I expect of you. Are you meeting your agreed upon deliverables? So am I getting my work done? And if I'm not, then I need to be addressing that from a performance perspective in a coaching session with my employee. Again, it's still telework, and I'm still going to expect the output of the work. I think as leaders, we have to make sure that we're doing regular check-ins with our employees who are remote from us. Although I've not been a teleworker, I've had people who've been geographically dispersed from me, and it requires a different cadence of communication and also different mechanisms. It's not as easy for me just to walk up to you if we were in the same office and you were at the desk. So I have to make the time to make sure that I'm reaching out to my employees. I'm calling them, I'm emailing them, I'm trying to schedule Zoom meetings so that we get that personal connection together.
So, from a compliance perspective, I would say, first of all, what Tommy did touch on was you do need to know what's legal within each of your states. And if your employees, if you're based in one state and your employees based in another, you may have several different state rules that are coming into play. And so that has to be considered as well. I would not be an advocate of spyware. If I'm working in my home, I should have some element of privacy. I should not be worried that my employer is going to be videoing me while I sit in front of the computer and, scratch my head and, get up and go take a drink, or my kid comes in and says something to me, whatever. But there are many ways that we can, from a compliance perspective, that we can absolutely track what our employees are doing without infringing on their privacy. And some of that's simply through auditing. There's a digital trail for everything that you do. Your footprint is there. As far as our healthcare workers are going, and even for for other businesses, if you're using any kind of platform where your employees got to go in and they have to input data, they're making changes, they're creating documents, there's a footprint. You're going to be able to see what they're doing. And so what's their productivity level supposed to be? If you don't have this preference that your employee is, absolutely working 8 to 5, but this is what your productivity should look like, then, I don't think, from my perspective, I would care if my employee did this at midnight in their pajamas, as long as the work got done. And so we can certainly look at the digital footprint. We can certainly audit to see what they're doing, when they're doing it. Just overall, making sure communication, I think that's key. And then just simply the auditing and the productivity, right? What is expected in this time frame? So if this was expected, whatever my task was, whatever my role was in office, if I'm doing that at home, I should have the same level of productivity from my home that I would have at work. And we can always track that through an audit trail.
Yeah, I think
that does not require a camera.
I will say the one thing that as employers are considering teleworking, though, they need to be cautious about their non-exempt employees and making sure that you have set parameters in terms of their hours that they're working and making sure that you're appropriately paying them under the Fair Labor Standards Act for all hours that they work. It's a little different with our exempt employees because we have to work what we work to get the job done. So just making sure that you're setting the appropriate guidelines for both your non-exempt and your exempt employees to remain in compliance with the Department of Labor regulations.
Go
ahead.
I would like to add, like, in terms of spyware, I feel like as an employer, if you feel like you have to use spyware, you may not have hired the right people to begin with. So let's start from the beginning and evaluate from that. I think if you hire correctly, putting the right person in the right place, micromanaging and spying isn't really necessary. And I'm a big advocate on just establishing KPIs and performance metrics, and those will speak to themselves. And if I think Elizabeth will attest to this, that if she wants to work at 1 o'clock in the morning, so be it. She won't be able to reach me because I don't stay up that late. But
that's one of the perks.
But I think it's just a matter of making sure, again, spyware, I think there's a bigger issue at play than that.
I will say, as an employee who's done the teleworking before coronavirus and now, there has to be, at least from an employee perspective, there has to be a level of flexibility because these are not normal times. This is not normal teleworking. I used to be able to telework from bus stop to bus stop. There was no interruptions. Tiffany would know I was getting that time cranked in. And yeah, I would have a few hours after my kids went to bed, but I was very productive between those hours. Well, now my kids are not in school. And allegedly, I'm supposed to be helping them with the school. But so that we have to accommodate for what real life is, because everybody is in that exact same boat right now. So it took us, even Tiffany, who's a great boss, and Angela, I'm sure experienced this some too, that it took us a couple of weeks to trying to figure out, because when she was having crazy time was a different time when my kids were having crazy time. So we sort of, Microsoft Teams has these colors you can associate with your profile. I started using that. If it says green, then that means I'm in front of my computer, I am working. If it says that at 1 a.m., it just means I've left on my computer and I've forgotten to change it. But
oh, is that what that means?
Yes. Yes, I am not working 175 hours a week. Work a lot. But if it says green, if it says the orange, which is sort of like away, then that means I have my phone with me. I can respond to you. I'm working off my phone, but I'm probably cooking dinner or helping a kid with something. And if it's red, if it's busy, then it means I'm having a meal with my children. I'm engaged and can't really be bothered. Email me so it's on the right, so I can get it in the hopper. But Tiffany and I had to sort of come up with that system ourselves so that I didn't have to every time email her and be like, I am now playing Risk with my children, or I am now walking the dog for the 47th time, or I need to go to the grocery store and it might take 4 hours, because those are the things that everyone's facing right now. So it may just mean, as Tiffany, y'all have all alluded to, communication is key, and trying to find a way for you and your employees using technology to your benefit, so you're not getting creepy spied on. That is just, no one wants to see what's going on in my house.
I do.
Well,
I think it's funny.
I'd like to circle back on the spyware issue just a little bit from a compliance perspective. And depending on the type of spyware that or tracking where that an employee or that an employer may put in place, we could run against some HIPAA issues as well. If that product, that application is recording data that's actually on that screen, now we're talking about, we've got this third party that's got data that's potentially stored somewhere. So I would absolutely, before an employer ever considers putting any type of software or application on any device to track what their employees are doing, if there's going to be a third-party application, that you talk with your compliance people first. Make sure that we're not going to violate any of the HIPAA rules, most especially when we're talking about the telehealth aspect of that. I'm not a fan of spying, but if an employer feels they need some controls, make sure you talk with your compliance person first.
I'd like to circle back a little bit to something Elizabeth was talking about, in that I think the telework, I think COVID-19 is going to show a pretty revolutionary shift in the way we want to work as Americans. Angela alluded to telehealth. I think it's been it's pushed telehealth beyond the boundaries that I think it would have just in a normal pace. And I think the same thing with teleworking. So technology and leveraging technology, I think, is going to become increasingly important for people to collaborate. So I think we're going to see much more reliance on team collaboration products like chats and team rooms, making sure that people are leveraging the technology so that it can still provide that structure with the flexibility that teleworking offers. I also agree that it's going to push a lot of employers outside their comfort zone because right now, like for example, I have a couple of folks that I work with and they have 2 young children at home. And so we're having to readjust their schedule so that they can take 2 hours off in the middle of the day to get their kids set up on Zoom meetings because they're still in school. And so as leaders, we're going to have to figure out and push ourselves outside of our comfort zone. It used to be, I'm going to lay my eyes on you and I know that you're working and I'm all good. And now we're going to have to push ourselves, think outside the boundary, figure out how to get comfortable with the new way the world is going to work. And it's exciting. I think it's really exciting, but it's also going to make us rethink kind of that traditional workplace environment.
I also think if you read a lot of studies too, that they say people working from home are generally more productive than if they're in the office anyway. So I think it's funny that everyone's like, there's so many employers like getting spyware, but really if you just lay off and let them they'll actually be more productive than they were if they were in the office.
I totally agree with that. I am so far more productive at home than I am ever in an office. Mostly because I'm a social butterfly.
It's not like I ever interrupt you at all, Angela. I don't know what.
Never. We go into an office and we never talk to each other while we're in there. No. So I find that I get a lot of stuff done at home when I'm focused on just my work. Yes, now it's a little more different because I've got so many kids that I'm trying to juggle and make sure that they've got that. But still, like when I come into my space and I sit down, even if I get interrupted, it's still far more productive than me going into an office where I just like to be a social butterfly.
I think we're going to see a much higher rate of dual scheduling where people are spending several days teleworking and several days in the office. And I think employers would be smart to think about that because again, the productivity, I think most people work harder to protect the flexibility that they have from a work arrangement from their employers. And I agree with that, Tiffany, 100%. So I think, thinking about what functions, job functions, can I let employees do at home? Can they do billing at home, credentialing, surgery scheduling? What are the things that they have to come in for? Patient care. They have to come to a team meeting to get that culture building and team building happening. So I think we're going to think about the work a little differently, and I think people are going to want to have that flexibility going forward. And I think we're going to see a lot more of that sort of dual type of working arrangement happening.
I think before COVID, I think for MPWRSource employees, we've been doing that dual. We have an office, but we would really just go in the office to work on a project, do client interfacing or have meetings. But most of us were still working from home when we're working on our own individual projects or doing what we needed. And I think it worked out very well that way. And I do have to say, in terms of team building, I think who hosted it? Cindy hosted a virtual event for all of us, happy hour.
Oh yeah, virtual happy hour.
And it was super fun. And then one of the employees, Kyle, he brought in, what was the name of that?
Oh,
Jack
it was,
TV?
yeah.
It was
Some
Jack
game.
murder mystery game or something.
Yeah.
Yeah, and we all played it together, so it was great bond building. So think about how, if this had happened 10 years ago, we probably wouldn't have been able to do that. Now look at, we were still able to bond as a team with our employees through that fun activity. So just because we're not face to face, there's still ways to interact and build a bond, and that was super fun.
Now, Angela Davis, you with Proactive Information Management, it's an information technology firm. What are some of the technological tools that companies can leverage to make this happen?
So,
like what's needed to set up an office to telework, basically?
Well, you need to be able to have communication. So Office 365 is great for that. It's got Teams, which we're on right now. And then you have SharePoint, which allows everyone to share data together, work on projects simultaneously, upload them, be able to communicate and work back and forth without having to email a million times a day. The same project over and over again. A lot of it's all done on the cloud, like it's software based. So it's not like you need to necessarily have or cloud based. You can do cloud based, but it's software based also. Sorry, my brain's going a million different ways. But so it can be virtually done anywhere. I mean, like you were talking, Elizabeth, about answering on your phone. It's not just text messages. It's, Teams messages, emails. I mean, you can pull up documents on your phone and be able to work from anywhere. You can sign into one system, walk into another room and sign into the exact same system and not have to worry about your data being lost. A lot of doctors' offices are using VPN tunnels so that clients have a secure connection from, the laptop that the employee's taking home or desktop to their systems on site so that they can keep track of, what's going on. So there's a lot of different ways technology can be beneficial in helping people work from home and securely.
So, thinking about that, and simply, you look at it from a HIPAA perspective, but just information security perspective, because ransomware is such a huge issue today. And with our employees going home and working, we'll probably see a rise in that, simply because we're going to be a little bit more vulnerable. A couple of things that employers need to think about, whether you're healthcare or any other industry. What security are you going to put into place? Are you going to have a bring your own device? Most security people call that bring your own disaster, right? Or are we going to provide the device to our employees? Are we going to have our IT? We have professional IT that will set up the security on those devices, that will manage those devices to ensure that employees, that those devices stay safe. Making sure that employees understand what they're allowed to do and not allowed to do on those devices. Doing system hardening, which simply means if something doesn't need to be on that device, take it off that device and don't give the employee the ability to download software or make changes to the device, any of the administrative controls. The more that we can think about that from an information security perspective, make sure that we know where the device is going to come from, if it's going to be the employees or it's going to be owned by the practice, who's going to be securing those devices, who's going to be monitoring those devices, who's paying for those devices. There's a lot of questions that come into play when you start thinking about that. And I know that I'm the compliance person. From a security perspective, I would always encourage the employer to provide the device, to secure the device, and to monitor the device itself. And that's not spying, that's monitoring, antivirus and firewalls, web filtering, running reports, making sure that our employees are not doing anything that they should not be doing. So, accessing Playboy in the middle of the night, something like that. You can do that simply by running reports off of that device to see where it's been.
Or blocking those types of sites altogether through your security filtering.
Mm-hmm.
Yes, and sometimes those get a little too tight, though. I This is okay.
You have to open it up for Facebook, right? So
No, this is, I was trying to look up a restaurant that's also a brewery.
yeah.
And I guess because the filter had said, you can't look up alcohol or something to that effect, I was like, I can't look up legends. I wanted to see if someone's playing. And I was like, oh, okay, well, I'll just look on my phone. But having those filters and stuff in place can protect your devices and your employees. What other
we're
things?
actually looking at a perspective now. Tommy mentioned blacklisting, which we still very widely use. But another perspective that we're looking at in the security world is whitelisting. So instead of having to go through and blacklist a bunch of sites, we determine what they actually need access to, and we whitelist those sites. And so that's exactly where you can go. So if you need to be able to access X electronic record or practice management system, this database, that database, this website, then we can go in and whitelist those to allow employees to access them. So that's another consideration that your IT professionals can talk through with different employers.
Yeah, we do that specifically with each one of our clients. Working through the list, we provide them a list of stuff they can whitelist or blacklist. And work on that web filtering so that they're having access to only what they need to have access to.
And that's a good practice, whether it's teleworking or in the office, right? So I will say too, in terms of equipment and also compliance with workplace safety, you should have a teleworking agreement if you're going to send somebody home. And generally in those teleworking agreements, what you would see is what's the schedule, what kind of core hours do I expect you to be working, if you're rotating in and out of the office, how many days are you coming into the office, when are you coming to be teleworking, what equipment I've assigned you, making sure that I'm tracking the asset tags on all of those things so I can recover that equipment. Expectations around printing, because that's a really big place where you can inadvertently leave confidential information or HIPAA information lying around. So I always recommend not allowing people to print when they're at home so that you can avoid that. How securely is their workspace? And then are you having the employee do a safety audit check to make sure that their actual home workspace is safe to work so that we don't get into work comp claims because they tripped over a filing cabinet because they have
like Legos, Tommy. Legos.
Yeah, so because all of those rules still apply when you're working from home because it is a work environment. So those types of things are really important to also set up and establish so that, again, there's clear expectations, clear communication between the employee and the employer related to expectations.
Angela Simmons, Tommy I'm going to jump off from something Tommy said. Let's say I'm a doctor or a dentist or a general practitioner. I have some employees that I want that can telework. In a dental office, that's going to be a little bit different, but you've alluded to scheduling and billing and maybe collect those types of things. And I guess we're going to be discovering more and more who can, how many of those meetings could have actually been emails. But what does that employee need to do to set up their home office to be HIPAA compliant?
So that is going to start with the employer. So if I am, and I think this is one of the COVID-19 has brought back to the forefront something that we should have always had in place, which was contingency planning. Mm-hmm. So if we're not able to access our location and we had to shift location for patients or employees, what is that location going to look like? What's the security going to be there? What devices are we going to use? How long is it going to take to get all of that? So the first part of it's going to be that we really, employers, no matter what area of business you're in, no matter what industry you're in, setting up your contingency planning first and describing what those offices, those home workplaces need to look like. When we're talking from an information, financial information, you're talking about patient information, you want the employee to have someplace within their home that they can close a door, that they can make sure that, I know that that's your children. I know that's your husband or your wife. That's your dog or your cat. But the only people that are supposed to have access to patient information are those employees of that practice, the patient themselves, of course, business associates. So the employees, right? They should have the access, and we should be limiting access to anybody else. And during this time, you may have extended family members or friends who are staying in your home. And so again, how are you going to control that? Making sure that we do have Angela said this earlier, having the appropriate security set up, the VPNs set up, making sure auto log off is set up on the computers. That's something that should be done regardless. Making sure our employees know that they do need to lock computers when they walk away. And no matter how important that assignment is for your child and the computer that they've been using just crashed, they don't get to use the computer that's owned by your employer, because anytime we do anything beyond what is actually a role for that employer on their device, we are raising the risk of a cybersecurity incident. Mm-hmm. So we definitely, those kinds of things have to be thought through, and there needs to be policy in place prior to this type of an incident occurring. And so I think we'll be rethinking this, and I've had a lot of clients talk to me about, now it's time. I've been talking to them for years, but now they're ready to get their contingency plans in place. Mm-hmm. Now they're ready to start talking about.
Kind of would have been good 2 months ago.
Yeah, I want to know, I want to make sure that I know what a home office should look like, and what security measures we should put in place. And part of that would also be who's paying, for what. Is the employer going to be paying for internet? Most of the time the answer is no, unless they're going to provide you a hotspot. And so, just in making sure that the policies are there and the expectations are clearly set, so that we ensure that that information stays as secure as is possible, no matter where it's accessed at.
Mm-hmm. Yeah. And I mean, I think, to reiterate, just because in my profession, I deal with a lot of confidential information. And, so that extends even beyond just, the HIPAA requirements. In our roles, we get exposed to financial data, employee data, payroll data, client data. And so all of those practices extend even beyond sort of the HIPAA and the healthcare space, because we have to make sure that we're protecting our reputation, and we don't want to be the cause of a data breach, right? And so all of those things are super important and critical. I agree.
Now I'm gonna pivot just a bit. The answer to this may be different for inside coronavirus from coronavirus time to not coronavirus time, but maybe the answer should not be different. So I have employees teleworking, and my employee is sick. Maybe they have COVID-19, maybe they have the flu, maybe they have wicked bad allergies because the pollen has not read the room and it's horrible. What does a sick day look like for the telework employee from an employee perspective? I mean, I know as an employee what I've heard employers say and what I'm capable of doing, but as an employer, what is your expectation for an employee teleworking?
Tommy, I think that's mostly you.
Well, I'll jump in.
I have a couple of little thoughts, but I think there's mostly an HR perspective to that.
Yeah. I'll answer it both from a leader perspective and an HR perspective. First off, how bad is it, and can you work? Because sometimes, I've been sick and I've worked from home and I've been just as productive. So I think, again, it gets back to that understanding of what the employee's role is, what they're capable of. But if somebody's sick and they can't work, then they should take a sick day. And it's no different than if they were coming into the office. I think people who can still work and be productive I think that's a conversation between the leader and the employee to make that decision collaboratively. If it's COVID-19, there's a whole bunch of rules out there that came out not too long ago, the FFCRA stuff for small businesses. So you need to make sure that you're complying with those requirements as well. So I think it depends. But I think I generally prefer to work directly with my employees. And, if it's just hay fever, they're not feeling great, but they want to keep working and they feel like they're capable, I tend to trust my employees with that. But again, I think it's going to come down to that conversation.
Great. And I think there's, when you're thinking about that, there's a little bit of a difference, right, between telework.
Yeah.
So I am just working at home. And so I can be the steward of that, and I can decide if I'm well enough to actually do some work or if I need to be in bed.
Yeah.
But when we're speaking of telehealth or other situations where the employee is interacting with a client on the other end, one of the things that from an infection control perspective that I have preached for years is you don't work sick.
Mm-hmm.
You are going to make somebody else sick that way. But in this instance, I'm not worried about that you're going to make the person on the other side of that screen sick. But let's go back to that reputation, right? Do I really, as a patient, do I want to talk to a provider who's sick? Probably not. As a client of some major financial corporation or somewhere where you're dealing with confidential data, do I want to be looking at another person who, is green around the gills? Probably not. That may not instill a lot of faith in me for that company. And so I think that there needs to be some clear expectations. And there is a huge difference in what am I just doing in my home for my company versus what am I doing that's client facing or patient facing.
Yeah, I think that's a great point. And I think, again, it comes down to having that conversation, making sure people, understand your expectations as a leader, and treating people as adults, right? I think people try to do the right thing in the workplace. And so people who are sick will usually communicate with you, what's going on. So, but you're right. I think the client facing versus the things that I can just do at home as part of my job that's an important nuance.
Well, I think too, one of the things that that we have to consider, and maybe this is, more from an employer perspective, because employees are going to, whatever their situations are and whatever their environments are, they're going to make decisions about working sick based on a lot of times what they can afford to do.
Mm-hmm.
And what they feel like they're able to do. But from an employer perspective, we need to give employees the right to say, I don't feel good and I know I'm sick and I don't need to be in the office today, or I don't need to be dealing with clients today. And so there should never be this issue where the employee feels like if I call in sick, I'm going to get in trouble. If I call in sick, I'm going to lose my job. And I think that that's a little bit of what is happening, or a good portion of what's happening in the workplace. We are making it impossible for our employees to feel like they can take a day off. And so I think we have to change that dynamic first. I don't know how we change the dynamic, or if we can, the dynamic of that employee who feels that they can't afford to take a day off. But we can certainly, from our perspective, make sure that they know their job's not at risk because you've got a cold or the flu or COVID-19.
Yeah. And I think it depends on the employee, right? Because there are employees who do have attendance issues, and they may well be in a state. And so making sure that you have, again, getting back to that communication, setting the expectations with employees in terms of attendance, and then structuring the right policies so that people can take that day off and not jeopardize the workplace as well. And I think a lot of the laws and stimulus package requirements that have been passed are trying to get employers to encourage people to stay home while they're sick. And so I think we will see a shift in time off policies related to illness with companies prospectively, especially I think in the health and dental fields.
Yeah, we will be, Centrovance will, for all of our clients, will be strengthening the infection. All of our medical dental clients have infection control policies, and we will be strengthening those policies to make sure that it is addressed in there when employees are sick. What's, not making them get a doctor's note. I'm not always going to go to the doctor because I've got a cold or the flu. I know I've got the flu. I need to stay home and I need to stay in bed. But then there may be some consideration on the backside. Do we need a doctor to clear them to come back to work? And so we are going to be for all of our clients and increasing or strengthening that infection control policy to make sure that it covers the employer and the employee appropriately and protects our patients.
Mm-hmm. Absolutely.
We've got about 10 minutes left, and each of you have sort of hinted at what I'm about to ask next, but I want all of y'all to put on your prediction hats. Coronavirus has changed a lot of things, from our face mask fashions to, pajama pants fashions. But what are your predictions in your wheelhouse, whether it's technology, compliance, HR? What are your predictions? And, some of these changes personally, I think are going to be for the benefit of everyone. We've gotten this opportunity to have a big reset button to some degree, and we've all taken it collectively at the same time. Industry wide. So what do you think moving forward? How will technology and teleworking change? How will compliance change? How will HR change? How will communications change because of what we've all experienced right now? I'll let Angela Simmons go first because she looks like she has a really good answer.
I do. I'm just fighting at the chomp. So from a compliance perspective, I don't think that we're going to see major changes in rules that allow you to not protect patient information, not protect confidential information, not have information security in place. But what I do see is, most especially with telehealth, I think we're going to see an expansion of that. Up until COVID-19, so up until 2 months ago, we had a very short list of services that could be provided in the telehealth, telemed world, and that's been expanded. There's probably 100, 150 services that have been added because we have to be able to do that. It is better to be able to screen patients before they come into the practice. It's better to be able to see them on a screen, talk to them. Maybe I don't even need to see them. It's as simple as that. But I think we'll see telehealth expand some. I think we'll see providers that will likely try to use that model a little bit more, because one of the issues that we have, and I think we talked about this on a previous topic that we had, where our waiting rooms are just packed out, right? And if you think about cold and flu season, it's like October to May. We only have 3 or 4 months that we're not worried about sickness, really, right? And so do you want your waiting rooms packed out? If you've got one person sitting in your waiting room that has the flu, how many other people are going to get it? If you've got one person sitting in that waiting room that's got COVID-19 and they don't realize it, right? We have asymptomatic carriers, or we have people that know that, gosh, I don't feel very good, but I don't know what the problem is. And so I think we'll see a shift in how we triage our patients and how we bring them in to our practices. And I think that's a good thing. I think in the dental world, it's going to be a little bit more difficult, simply because there is no provisions really in the telemed world for dentistry. And if you stop and think about it, it involves your teeth. And so we've got to be able to look in. Yeah, we got to be able to look into that oral cavity. And a lot of times that's going to require a little bit more than just what I can see with my eyes. So I think we will see some shifting. Where the differences we'll see in the dental world will be surrounding and really just going back to what's already been in place. There are some OSHA rules in place to protect your employees, and it's high time we start looking at them again and put them back into place. So I think we'll see some expansion of telemed. The compliance is going to stay there. We're going to have to rethink security, but I think we're going to see a shift, and I think it's going to be a good thing.
Tommy, what about you?
Oh, I think the HR space is going to change and has been changing pretty wildly through this crisis. And I think coming out on the other side, I think we're going to see much more reliance on teleworking, technology and collaboration, flexibility in the workplace. And we were already starting to see those trends happening with, you know, the millennials coming into the workplace. And as technology starts to change and the speed at which technology changes, I think we saw that, but this really just ramped it up. I think people are going to be really hesitant coming back into the workplace as businesses start to ramp up as well. I think this situation has really made people very cautious about interacting with other people. And so, you know, we're going to probably need to rethink some of those types of things related to our team members. People might have more preferences to work from home. And I think as people are planning their ramp up plans and coming back into the workplace, what do those policies look like? You know, are we going to allow people to sit in our break rooms? Are we going to put food out on the counter for sharing? You know, different things like that are going to be things that we need to be thinking about as we reintroduce people into the workforce too. So I think on the HR side of things, it's going to change a lot. And I think a lot of it's going to be really good and really positive, but we're really in a lot of unknown territories right now. And there's a lot of things to think about. You know, how are people going to take care of their kids when they have to come back to work? There's just a lot of challenges related to that. So I'm excited to see how technology is used and how teleworking gets leveraged as we go forward. I think we're going to start seeing a lot more people doing it and continuing to do it after we get through this crisis.
Right, you, the other Angela Davis.
Well, I agree with Tommy. I think there's going to be a lot more businesses that are really going to push towards going telework. They're seeing that they don't really need to have that brick and mortar business anymore. They can, you know, have all the technology that they need spread out all over the place. You don't have to have just employees in one state. They can have them all over the place. And I think there's going to be a lot more risks that are going to come up with that, with the technology, and getting those businesses to realize that they're going to just need a whole lot more to protect themselves, because it's not just one point of entry anymore. It's numerous points of entry. And, you know, getting with the clients and working with businesses on how to protect themselves, you know, how to protect themselves HR, how to protect themselves with compliance, how to protect them with IT. I mean, it's just going to be a lot of businesses needing a lot of help in all those situations, because there's going to be so many employees wanting to work from home.
If I could give one piece of advice, I guess, to anybody listening to this when you're thinking about the telework, because I mean, it's here, and it's obviously something that I think we are absolutely going to have to give more thought to, because we've, you know, right now, many businesses have people crammed into rooms, right, on phones, and so spreading these people out. But I think my recommendation would be make sure that you have good IT professional. Make sure you have good compliance people. Make sure you've got good risk people. Make sure you've got good HR. And if you put that foundation in it, so basically it comes down to a foundation of compliance. If you put that in place and you get all the right people together, you get all the right people on the bus, then this is something that we can do, and it's something that we can sustain. But we want to make sure as we step further into it and we look at it as more of a permanent solution, that we have the IT people and the compliance people and the HR people, the risk management folks all in place on the front side. So what you're doing then is you're building that compliance by design, HR by design, privacy by design, all security by design, instead of adding that on the backside.
Yeah, it's much easier to do it proactively, Angela, like you said. Have your contingency plan in place versus trying to chase it down on the back end. It's a nightmare trying to chase it on the back end if you're not prepared.
And Tiffany, what are your predictions?
I think that, you know, a lot of things that were already evolving and changing before COVID, and I think COVID is just speeding a lot of stuff up, which there's a lot of positive that's coming out of it. Not only telework, I mean, the United States is kind of behind in that comparatively to a lot of countries. And I think we're seeing, you know, obviously that's going to change dramatically, obviously with telemedicine as well. I think communications, given the millennials that Tommy brought up, and with Gen Z, they require transparency and communication is key. And I think moving forward, that communications needs to be as transparent as possible with every organization, not only within their internal employees, but also with their clients or patients. So one of the things we do at MPWRSource is inbound marketing, and inbound marketing has taken off by storm, but even more so now with COVID, because your website, as I always say, is your Wikipedia for your business, and you want people going to you as the expert. Well, we're all behind our computers now. Where do you fall? You know, are they going to you? So I also think that with everything that's going on with COVID, you know, I was listening to Angela and Tommy talk about, you know, how things are going to change in the medical practices. And as someone such as myself who suffers from severe asthma and allergies, for years I've always wondered why they mix the sick people up and the well people up in the waiting rooms. I've never understood it. So I've always contended, do I go to get my asthma and allergies checked on, or do I stay home because I really don't want to get the flu? Because if I get the flu, that could lead to pneumonia, blah, 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 blah. And I think those kinds of things are going to change too. I mean, I think there's just a lot of positive, and I think also what's going to change is it's going to cause some compassion and empathy for those who do have certain ailments. Like during COVID, you have people who have different, you know, are higher risk, and so that it's forcing everybody to be more conscious of those around us. And how can that be a bad thing? It just can't. Only good.
I agree. You took Tiffany, the words out of my mouth.
To your point about the sick and the waiting area, the interesting thing to me is that from a compliance perspective, when I go into practices, pediatric practices are usually pretty good. They have a sick waiting area and a
even have different doors
area.
Yeah,
different
they're
doors.
amazing at it.
But we
I mean, people have licked all the toys in both.
Yeah, so that's right. But we do that nowhere else, and I think that is something that does have to be considered going forward. And I think the telemed will help with some of that, alleviate some, but we're still going to have to think about what our design is for the practices themselves as well.
It's almost like Outback. You go and get one of those things, and then you go wait
I
in your
love
car
that
and
idea.
Rings. You know,
that's right.
Text me in my car. I'll wait in my car.
Yeah, wait in my car. That candy's not going to crush itself, so I'll just do that in my car. But Tiffany, you spoke to what it was going to be my takeaway was as a content developer, everybody, even just what we're doing right now, webinars, at the end of the day, providing good information to your target market, whether you're in HR or compliance or tech, that's what you need to be. And that's what we at MPWRSource do, is help people provide content. And so content is king, whether you are Joe Exotic or a pediatric office, you know, having people know what you do is important. And so I don't think that's going to change. I think that's going to evolve as we move forward. And I'm also really excited about the prospect of getting to work more in my soft pants. Big fan of that. But I wanted to thank you ladies for joining me here today. Thank you, Dr. Maynor. And we are going to I'll put this recording on all the usual spots on YouTube and on our website. Now I'll make sure everyone gets the link and has access to it later. And if you have more questions later, I can get you in touch with one of these smart women and they can answer your questions. Thank you very much for coming today and joining me.
Thank
you.
Bye.
Bye.
Bye.